We'll continue with the previous lecture, how extracellular calcium ions will alter the excitability of the neuronal or muscle membrane. So when the calcium levels in the extracellular fluid is normal, what is the normal calcium levels in the ECF? It is around 9 to 11 milligrams per deciliter, or in millimoles it is around 2 to 2.5 millimoles per liter. So this is a normal plasma or extracellular fluid calcium levels. So with this extracellular fluid calcium level, let us see the response of voltage gated sodium ion channels and generation of action potential. So this is the membrane, and consider this is the voltage gated sodium ion channel. So for the activation of voltage gated sodium ion channels, threshold stimulus is required. So what is the threshold here? Normally in skeletal muscles, the threshold stimulus is around minus 50 millivolt, and the resting state is around minus 90 millivolt. So that means when the membrane potential from resting level minus 90 millivolt, it is taken to minus 50 millivolt. When the membrane potential is taken to minus 50 millivolt, the action potential is generated in the skeletal muscles. So this is the firing level. The firing level, the threshold potential is minus 50 millivolt. So how much change that has to be made in the transmembrane potential is around, from minus 90 to minus 50 means it is around 40 millivolt change has to be made to activate the voltage gated sodium ion channels, and voltage gated sodium ion channels will respond with the 40 millivolt change and action potential generation or excitation of the muscle. Now we will see what happens if the calcium concentration is more in the extracellular fluid. So consider the calcium concentration is around 5 millimoles per liter. So this is more than that of the normal values. So when there is increase in the calcium concentration, what happens? It binds to the voltage gated sodium ion channels. The calcium positive charged ions will bind to the voltage gated sodium ion channels, so that the voltage gated sodium ion channel transmembrane protein electric nature is altered. So and this threshold levels for opening up of the gate of the voltage gated sodium ion channel, the threshold level will be increased. Now let us explain this with the graph. See what happens when there is increase in the calcium ion channels. It binds to the voltage gated sodium ion channels. So the threshold potential for this voltage gated channels are increased, so that when the stimulus is applied, the membrane potential from minus millivolt, it has to be taken to very high levels, that is around minus 40 millivolt. So the difference is around 50 millivolt difference here. So at only minus 40 millivolt, this is a threshold potential for generation of action potential now in case of increased extracellular calcium ions. So what happens with the increase in the extracellular calcium ions, the threshold potential for opening up of gates of voltage gated sodium ion channels are increased. So thereby the excitability is reduced. So whenever there is increase in calcium ions channels, whenever there is increase in calcium ions in the extracellular fluid, this hypercalcemia will decrease the excitability by increasing the threshold levels, by increasing the threshold voltage that is required to open the gate of sodium ion and generation of action potential. Now we'll see when there is a decrease in calcium ions, how it affects. So decreased calcium ions. So consider a situation where the calcium ions are around 0.5 millimoles per liter. So in this situation, we'll plot a action potential graph and see where is the threshold potential. So the resting membrane potential is 90 millivolt for skeletal muscles. So when the membrane potential is taken from minus 90 millivolt to minus 60 millivolt, so that is around change of 30 millivolt change. So 30 millivolt change from minus 90 to minus 60 millivolt. So action potential will be generated. So that means the threshold here is very less. So whenever the calcium whenever the calcium is decreased, whenever the calcium levels in the extracellular fluid is less, the threshold level for generation of action potential is also less, and with in short strength of the stimulus, with the lighter strength of the stimulus, the membrane will become excitable. So there is increased excitability of the cell, and generation of action potential will be quick in case of hypocalcemia, and that is the reason for hypocalcemic tetany. So tetany is sustained contraction of the skeletal muscles you find in case of hypocalcemia. So hypocalcemia, there is increase in excitability of the membrane, and the reason for increased excitability of the membrane is in case of hypocalcemia, the sodium channels will have the lower thresholds, that voltage threshold for the opening up of sodium gate is less, that is hardly 30 millivolt. Change from the resting state to firing level will excite the membrane and action potential will be generated, and this is because of less number of sodium ions, less number of calcium ions binding to the voltage gated sodium ion channels, and the electrical nature of the protein is such that its threshold level is reduced. If at all more calcium ions are bound, the threshold level is increased and there is decrease in excitability. So this is the physiological basis for hypocalcemic tetany that you commonly find in case of hypoparathyroidism. In case of hypoparathyroidism, so whenever there is decrease in parathyroid hormone, the plasma blood calcium levels decreases, and the signs of hypoparathyroidism is carpopedal spasm. So carpopedal spasm is nothing but an obstetric hand where there is a spasm in the hand. There will be flexion at the metacarpophalangeal joints and extension of the interphalangeal joints with adduction of the thumb. This is the carpopedal spasm, and this is because of the sustained contraction of the muscles because of increase in the excitability due to decrease in blood calcium levels. Thank you.